It relies on being very systematic in the data that we collect, and in the UK we're very lucky because when we treat patients with CAR-T on the NHS programme, we are able to track those patients and we're collecting data to make sure that we're able to really demonstrate what the outcomes are of those patients that fail that therapy and what they go on to have. So that's work that's in progress. The optimal treatment pathway post-CAR-T and having failed CAR-T isn't clear. There are data from groups in the US that demonstrate if you have a short persisting CAR and you go on to an adjunctive transplant, that you can have an event-free survival following that transplant that can be in the order of around 65 to 70%. But for patients who've had a prior transplant, the story is a bit less clear because the associated toxicity with the second transplant is more significant. So certainly if you're a patient who's failing CAR-T therapy, perhaps because of short persistence and not because of disease relapse, we know that providing a transplant is probably the next best step and you can have a really good outcome from that. Unfortunately, for those patients that had a prior transplant and then failed CAR-T, the route is less clear, but we're hoping to be able to define those outcomes by looking at the UK cohort of patients coming through the NHS therapy. With that, we have very systematic data collection and hopefully we can provide outcomes on those longer term outcomes as well.